It can be pretty overwhelming and scary to learn that your child is at increased risk of serious injury due to accidents related to ADHD. The good news is that research shows that when ADHD is well managed, that risk goes way down. So, depending on how much a child's ADHD symptoms are interfering with their daily life and how serious the symptoms are, medication may be one important component of reducing that risk. There are also behavioral strategies that parents can use to reduce that risk as well. And these are strategies that are based in the same principles that underlie parent behavior management training. So, because kids with ADHD are not kind of anticipating and thinking ahead, they're more prone to distraction or being impulsive. The parent, unfortunately, has to be that frontal lobe that provides the consistency to develop safer habits. So, some of the injury risk is due to distraction, and that would include things like walking toward your friend and not looking both ways when you walk into the street, not forgetting to put on your helmet when you're riding a bike. And some components of the injury risk are also related to impulsivity. So, for kids with more of a hyperactive impulsive component of ADHD, that might be risk taking behaviors, climbing higher on things, doing things that aren't very safe without thinking it through. So, kids with ADHD are going to need more structure to begin with before entering a scenario that could be risky. So, that means that parents are going to have to lay out some ground rules and some strategies really clearly and more frequently than other kids might need. So it may seem really obvious to us that, when you're walking on the shoulder of the road, you need to stay on this side of the line, or when you're crossing a driveway, you need to stop and look both ways. But those things are not going to be front of mind for a child who's distractible. So parents are going to need to really consistently model that, talk it through, walk through the process out loud as it's happening, and maybe even relying on little rhymes or jingles. I know shows like Daniel Tiger or The Wiggles on YouTube have little songs about looking both ways and dealing with various safety scenarios. For older kids, though, you can lay these out as really clear ground rules about how the family stays safe. The other piece is on the consequence end. Sometimes you might need to really instill how important these things are by linking a contingency. So that means, if you have a family rule about no jumping on furniture or beds, you've got to really uphold that every time, not make exceptions, but possibly it needs to be linked to a consequence if your child isn't motivated to follow it. That consequence allows enough dopamine to enter the brain that it becomes more motivated to follow the rules. So, parents, it's not a hopeless case. There are lots of things you can do to instill good and safe habits in kids. It does require more work than other kids might need to develop those habits. But there's a lot that you can do with thinking ahead and being really clear about your boundaries and contingencies.